Joining me this morning is a special guest, a new addition to the Ear, Nose, and Throat Institute, Dr. Mary Beth Williamson. Glad to have you.
Thanks for having me.
And Dr. Williamson, you should know, is a pediatric ear, nose, and throat doctor. I know as a listener, you're thinking, ear, nose, and throat, isn't that specific enough? I mean, do you really have to have a specialty under that? And you do. And Atlanta is in dire need of this specialty because Dr. Williamson has such an interest. It is her personality to do what she does. You know, she reminds me as much of just a caring mom, a caring pediatrician, and here she is a surgeon, and surgeons are not always thought to be as caring, but I'm going to tell you, this is one of the most caring doctors I've ever met, and that's why I begged her to come to Atlanta, come back home from Colorado. So I hope you feel welcome, Dr. Williamson.
I do. Thank you.
That's great. Well, you know, we were talking off air a little bit about the Affordable Care Act, and though I don't think you anticipated discussing some of this, you do come from Colorado. And how were they embracing or not embracing the Affordable Care Act?
Well, I think it was really embraced on both the individual level and also on a state level. And I think that's a good thing for people who need to find either insurance or be able to get on Medicaid, you know, especially families and children.
And that's why Medicaid is important, certainly to those of us at the ENT Institute and anybody that deals with children, because you know, we've got to take care of them. There's no doubt. And not expanding Medicaid, the thought is that it's putting them at a disadvantage in the state of Georgia. And having just arrived to Georgia, we'll see how it goes in 6 months and have you back to discuss that. The concern is, do you know in Colorado what Medicaid would pay the hospitals when you would take a child to surgery? Do you have any idea what they'd pay for a tonsillectomy?
I think it's about a third to a half of what a private insurance would pay.
And do you have any idea what that amount is? And this isn't a gotcha. I'm just, trying to help our listeners understand how much money goes there.
I don't know the entire surgical cost, but in terms of the surgeon being reimbursed, you know, tonsillectomy is usually around $450 with private insurance, and I believe Medicaid paid around $180.
That's right. That's probably about right. I think it's even less in Georgia because Georgia is in the bottom 5 of states. Okay, there are 45 states for sure above Georgia in reimbursement to physicians. Okay, that's how little they pay out on Medicaid in Georgia, and this I think it's our duty socially, morally, to take care of these kids. And so, as you know, at the ENT Institute, we don't discriminate. But there is a lot of discrimination. And part of the discrimination is how Medicaid pays the components. You know, the anesthesiologists barely get paid. In fact, if that's all they did, they couldn't do it. We, as surgeons, don't get paid the value for our time and what our overhead is. And that really is what it's about. It's not that we're so special. It's just about that overhead. And the hospitals traditionally get paid more than any of you even know. Thousands of dollars. Thousands. And that is the big secret. And I think we need to start holding our elected officials and the whole industry accountable for it. So as a surgeon, Dr. Williamson, you never saw the hospital bills that for the patients that
That's
are on
true.
Medicaid.
That's true.
And one thing that I think I want our listeners to know, you are entitled to your hospital bill. That is different from what's called an explanation of benefit. An explanation of benefit is what you receive from your insurance company. And it makes no sense for Medicaid to send out explanation of benefits because the patient's not paying much, if anything, for that service. So why waste the money? I agree with that. Why kill trees to send out statements telling them how much they paid the hospital? But you as a patient, I do not care what plan that you're on, even if it's Medicare or Medicaid, you are entitled to your hospital bill. And so, Dr. Williamson, the reason I know what they're paying is because our patients, who could be 50 to 70 a month that we take to the hospital, we ask them, as you will be doing, will you bring me your hospital bill? And we are able legally, in the patient's behalf, as advocates for our patients, to see what the hospitals are being paid by Medicaid, and it will blow your mind. It's unbelievable what those amounts are. And so I think that we really need to address in this day and age what these costs are. And that's what this show is about. It is about trying to help you navigate your health care and what you're spending for it. Because as time goes on, many have already seen the Affordable Care Act in action, and they know how much money they have to spend out of pocket to get these services. So I will tell you that in the local arena here in Atlanta, under Medicaid, sometimes they even get paid more than the private insurers are paying them out of Medicaid. And that is a secret that no one wants out for some reason. But in my discussions here at the state level, there's a big concern about those dollars. So maybe if we got better value for our money, then we'd be less concerned about some of the expansion dollars. The concern about the expansion dollars for Medicaid here in Georgia is that right now the federal government is going to subsidize all of that money, or 90% of it, over a period of time. The concern, not to get caught in some of the details, is that eventually, 3 to some odd years out, they just may change their mind and say, we're not going to fund it. Now you got all these people on Medicaid. What are you going to do? Well, the state, I think, elected officials will feel obligated to continue this and raise taxes to cover it. So anyway, we'll come back with more thoughts on that and with Dr. Williamson directly. You're listening to Doc Talk with Dr. Jeffrey Gallops on Talk Radio 640 WGST.